Good afternoon, everyone, and welcome to the Multicultural Media Online Forum hosted by New South Wales Health, Multicultural Health Communication Service, and Multicultural New South Wales. Thank you again for joining us. Today, you'll be hearing updates from Dr. Marianne Gale, Deputy Chief Health Officer, and we also have a special guest. Minister for Multiculturalism, Natalie Ward, sends her apologies as she's unable to join us today, but she'll be back again soon. Today, we do have a special guest, National Center for Immunization Research and Surveillance, or NCIRS, Staff Specialist Dr. Ketaki Sharma, who will be able to provide us all we need to know about the booster vaccination. I'm Jesusa Helaratne, Deputy Director of the Multicultural Health Communication Service, and we will have 30 minutes for your questions. So please, we request if you can please keep your microphones on mute, put your questions onto the chat, and we'll try to get the answers from Dr. Gale and Dr. Sharma. And would first like to acknowledge the traditional owners of the land from which we are all meeting from today. We acknowledge and pay respects to elders, past and present and emerging, and pay respect to colleagues, Aboriginal colleagues, and also pay respects to elders of multicultural communities represented today. So we'll start on to our session. We really thank you for always joining us here. We'll get an update from Dr. Gale. Dr. Gale, how are you today?
Hi, Jess. I'm very well, thank you. Nice to be here. And for those of you online, lovely to be here as well. And you'll notice today I'm not in the room with Jess, so dialing in from offsite. So in terms of an update from me, Jess, for everybody, obviously we're pleased to see at the moment that our case numbers are remaining relatively low and relatively stable. And I think that's a great testament to everything that the community is doing to follow the public health advice. And as we open up, people are going cautiously and observing important messages like mask wearing, particularly indoors, maintaining that physical distancing, washing hands and hand hygiene generally, and very importantly, getting tested, even if you have the mildest of symptoms, and very important not to go out and about when you're unwell. Don't go to school, don't go to the gym, don't go to the shops if you're unwell. Get a test and stay home until you get a result. So very important message. And as well, obviously, again, a very important message for the community about getting vaccinated. And we're really pleased to see our vaccination coverage continue to increase. It's really fabulous. So we've now got more than 93.6% of people aged 16 years and over receiving a first dose of a COVID-19 vaccine, and over 88.3% of people now fully vaccinated. So really terrific. And we're seeing those numbers increase as well in our younger people in the 12 to 15-year-old age group. Over 79.5% of people have now had a first dose, and 63.7% of people are fully vaccinated. So a great thank you to the community for continuing to come out in those numbers to get vaccinated, and a really important reminder to people who haven't yet got vaccinated to please do so as soon as you can. And an important message to the large number of people out there now who have recovered from COVID-19, that if you haven't yet got vaccinated, there's no need to delay. If you're feeling better, if you're fully recovered from COVID-19, please go and get vaccinated. And if you're unsure, do discuss that with your doctor about the best timing of vaccination for you. I think other just few key things to highlight, Jess, is that while we are seeing those lower case numbers, we are seeing increases, particularly in our regional areas. And so if you live in the regional areas, and particularly in the Hunter area, and we're seeing increases as well in the Murrumbidgee area, to please, and also in the Mid-North Coast, please be extra vigilant. If you live in the regions, please monitor for symptoms and please get tested if you're unwell. And another important message is that we are seeing an increasing proportion of our cases in younger people. And so again, if you're a young person and you're eligible for vaccines, or you're over 12 years of age and over, please do get vaccinated. You can still catch COVID. You can still become unwell. And importantly, you can still pass it on to people in your household and your loved ones who may be less fit and well than you are, such as elderly parents or elderly grandparents. So if you're a young person and you haven't yet been vaccinated, please do go and do so as soon as possible. That's probably enough from me. Thanks, Jess.
Thank you so much, Dr. Gale. And again, would like to welcome our special guest for today, National Center for Immunization Research and Surveillance, Staff Specialist, Dr. Ketaki Sharma. Hello, how are you, Dr. Sharma?
Well, thanks, Jess, and thank you for having me.
Thank you. And it's really important for us to answer some questions that we've had on booster vaccinations. The first question we have is, what are the recently approved international vaccines recognized by TGA?
So the two new ones that have been added just this week are two inactivated vaccines. One which is developed by the Chinese vaccine developer Sinopharm, and one which is developed by an Indian vaccine developer, Bharat Biotech, which is called Covaxin. So these join the other vaccines that were already recognised, which are Coronavac, another inactivated vaccine made by Sinovac, which is also from China, and Covishield, which is the Indian manufactured equivalent of the AstraZeneca vaccine. And of course, the TGA also recognises those vaccines which are already registered for use in Australia. And those are the AstraZeneca vaccine, the Pfizer and Moderna vaccine, and also the Janssen or Johnson & Johnson vaccine, even though we're not using it. So that's the total list of, I think, 8 vaccines that would be recognised.
Well, thank you, Doctor. We just want to know, what is the process of approving these vaccinations?
So the process involves evaluating all of the vaccine information that's publicly available on the safety and the efficacy of the vaccines, and efficacy referring to how effective are they at preventing COVID-19 infection and preventing severe illness and complications. And the TGA also reviews additional materials from the World Health Organization and from the manufacturers directly. So it's an ongoing process, which means as new information becomes available and as further studies become published, they can revise their list of which vaccines are recognized, and potentially we'll see that list grow.
Thank you so much. A question that we have here: vaccines for children, how effective are they likely to be? And I'll ask this also to Dr. Gale, but that's a question that's coming up in a lot of forums.
So the vaccines that have been tested so far in children have been shown to be highly effective. This includes the Pfizer and Moderna vaccines, which we have here. The efficacy in the studies that have been done in adolescents, done down to 12 years of age, and even now we've got results from 5 to 11 years of age, are showing that these vaccines are in the range of 90% or higher, even up to 100% effective in preventing COVID-19 infection. And that's not surprising, because children and adolescents have a different immune response to adults when it comes to vaccination. And if you take, for example, the Pfizer vaccine, adolescents aged 12 to 15 have an immune response or an antibody level that is almost 2 times higher, so 1.7 times higher than young adults aged 16 to 25. And as you can imagine, young adults also have a really strong response to the vaccine. And so this is why for the 5 to 11 year age group, Pfizer is actually using 1/3 of the adult dose, because they've found that to be equivalent in terms of producing a strong protective immune response. So overall, it's showing us that we can expect those vaccines, and very likely other vaccines, to be highly effective in children, and probably more effective than older adult age groups, just because of the strength of their immune response.
Thank you so much, Dr. Sharma. Dr. Gale, what with this kind of information, what should parents be looking out for and in preparation for their vaccines for their children?
Thanks, Jess. Look, I think it's, as Dr. Sharma outlined, there's really positive news around the efficacy and effectiveness of vaccines in younger people, and we look forward to being able to provide vaccines for children under the age of 12 in New South Wales when that becomes available. I think an important message in the meantime is for parents to acknowledge that the best thing at the present time to keep younger people safe from COVID infection is for the people around them to be vaccinated. And so if you have young children or mix with young children, the best thing to do to protect them from becoming infected is to be vaccinated yourself. And that's important for us to do as a community while we wait for vaccines to become available for children under the age of 12. And we know that young children, for the vast majority, COVID is a mild disease, and Dr. Sharma could speak to this far better than I can, is a mild disease, but young children can still get sick, they can still end up in hospital, and they can still have some health effects after having COVID, even though that's uncommon. And they can also transmit to people around them who might be at greater risk of severe infection. So COVID-19 in young children is not an insignificant illness. Vaccination is important, and we look forward to providing that to children when that's available, children under 12. And in the meantime, the best thing that we can do as a community is for anyone who's around children under the age of 12 to be vaccinated themselves to protect those younger children.
Thank you so much, Dr. Gale. There's a question here in the chat. What are we doing about pockets of low vaccination in Western Sydney in coal disadvantaged communities?
Oh, thanks, Jess. Look, we know that while we have high rates of vaccination across many, many areas of our state, which is really terrific, we acknowledge that there are some pockets, both geographically, but also in certain groups of people, certain age groups, certain cultural groups, where vaccination rates are lower than what we would like them to be. And so it's really important not only for those individuals to be vaccinated, to reduce their own individual risk of becoming unwell and ending up in hospital, but also really important for us as a community to address and try and increase vaccination coverage in those groups to reduce the overall risk of transmission in the community. And so we know that there are some groups that have lower vaccination coverage in some pockets of our region, some areas of the metro area, as you mentioned, some of our called communities and Aboriginal people we know as well have rates of vaccination currently are lower than what we would like them to be. And there's a lot of efforts going on. I know there are many community leaders involved in efforts to increase vaccination rates and have been for very many months since vaccines became available. We know that our local health services are working very hard to engage and make vaccines easy to access for people who might struggle to do so. We know that our local GPs have been doing a great job for very many months to make vaccines available to their patients and people in their community, and also local pharmacies as well, who are right there embedded in the communities. So there's lots of efforts that have been happening for very many months to improve access and to engage with particular communities, whether they be cultural or in particular geographical regions, to be vaccinated. But the key message at the moment is that there's plenty of vaccine available. There are plenty of ways that you can access vaccine, and I'd encourage anyone listening to liaise and work with your local communities and get the message out there that for whoever hasn't got a vaccine yet or hasn't got around to it or has got various reasons for not being vaccinated, to please consider that and get a vaccine as soon as they can.
Thank you so much, Dr. Gale. We'll go back to Dr. Sharma. Dr. Sharma, how much protection will I get from a booster dose, and why do I need a booster?
So I'll answer the second part of that first. The reason people need boosters is because the protection from a vaccine, and this applies to many vaccines, can wear off over time. And that's because when you first have your vaccine, you have a very high antibody level, and it protects you from any infection, as well as severe infection, hospitalization, and death. Over time, that antibody level will naturally wane, which is a word to indicate it naturally drops. However, you have immune memory cells that take a little bit longer to get activated, but will still protect you from severe illness and death. And so what research has shown is that for COVID-19 vaccines, and in particular the mRNA vaccines that we use in Australia, like Pfizer and Moderna, there is some waning in the protection against any infection, which means that although you'd still be protected against severe illness and death to quite a good degree, possibly not as good as immediately after vaccination, but still very strong protection against those severe outcomes. The protection against catching COVID and potentially transmitting COVID does tend to drop off, and that starts around the 4 to 6 month mark. So the point of a booster is to then boost your immune response at the time when the protection is waning, and we don't yet know how much longer you then are protected from that booster dose. And that's what studies will now show, now that booster programs are being rolled out across the world. And then the first part of your question was, how much protection will you get from the booster? So booster programs of COVID-19 vaccines are fairly new, obviously, since some COVID-19 vaccination has only been around for several months. But Israel is, I think, the only country where we have data on a whole of population booster program. And that has shown across several age groups that the booster vaccine, and they've been using the mRNA vaccine Pfizer, reduces your risk of getting any COVID by at least about 10 times compared to people who are unvaccinated from a booster. And those are people who did have their initial course, they just didn't get the booster. And the protection is even greater against severe illness or death for the people who've had a booster. So in summary, when you're approaching that 6 month or longer mark after you've had your first 2 doses, although you're still likely to have good protection against hospitalization and death, it won't be quite as good as, you know, in the initial months after your vaccine. And your protection from catching COVID and potentially transmitting COVID won't be as good as it was initially. So the booster is intended to boost your protection against all 3 of those outcomes.
Oh, well, that's really good information. Also, I wanted to ask, do I get a choice of vaccine for my booster?
To a degree, yes, there is a choice. However, there is a clear preferred vaccine, which is recommended by ATAGI, and that is the Pfizer vaccine Comirnaty. The reason for that is, firstly, because it is the only vaccine that's currently registered specifically for use as a booster. And that's because in order to use a vaccine as a booster, the company needs to submit an application to the TGA, which they have done. And it has been approved for use as a booster in people aged 18 plus. So that's important. We're currently only looking at booster doses for adults. However, if you are unable to have the Pfizer vaccine, for example, if you've had a severe allergic reaction such as anaphylaxis to a previous dose, or for any other medical reason you are recommended to have an alternate vaccine, you can still have the AstraZeneca vaccine. There's just not as much research published yet on how effective the AstraZeneca vaccine is as a booster vaccine. But again, as further information becomes available, that may change and it may become more of an equal choice between the 2.
Thank you so much, Dr. Sharma. If you have any questions, please put them on the chat and we'll try to get Dr. Gale or Dr. Sharma to answer them. Dr. Gale, what are the grounds for medical exemption for vaccination, or in this case, booster?
Thanks, Jess. I think in essence, there's actually very few reasons why somebody would have a contraindication, or what we call a contraindication to being vaccinated with one of the COVID-19 vaccines. And what we do know is that clearly with each of the vaccines, and again, Dr. Sharma, as the expert in vaccination, could speak to this better than I can, and she might want to make some comments after me, but we know that people might have some reactions, perhaps after having a first AstraZeneca, but the vast majority of those people could then go on to safely have a different type of a COVID vaccine, like the Pfizer vaccine. And conversely, you might have a group of people who have a first dose of a Pfizer vaccine, perhaps have an adverse reaction, but then could safely go on to have a second dose or a booster dose of a different vaccine. So there's actually only a very small group of people who might actually have a real medical reason why they can't have either or any of the available COVID-19 vaccines. And that group of people is actually a very small group of people who might have an allergy to, for example, one of the components used to make the vaccine. But So in essence, there should only be a very small number of people who have what we call an absolute contraindication to receiving a COVID-19 vaccine. So that's a really important point to consider. The other thing is that we know that there's a group of people for whom it might be appropriate to have a temporary exemption. And that means for a period of time, the vaccination may not be appropriate for them. And that may be because they have a particular medical condition at a point in time, which is expected to change or resolve. So for example, somebody who might have had COVID-19 and they're still recovering. And so for a period of time, if they've still got symptoms, they might have an exemption for a period of time or contraindication for a period of time until they're better and until they can be vaccinated. So there is a bigger group of people who might have a temporary condition where they might have a medical contraindication. But in terms of the group of people who really at any time have a real medical reason why they can't receive any vaccination available in Australia, that group of people is probably very small. But I might ask Dr. Sharma if you wanted to add anything or if you're happy with what I said was correct.
Yes, I completely agree. So, there have been reports of anaphylaxis, which is the most severe type of allergic reaction to any vaccine, but it's extremely rare. So overall for vaccines, it's about 1 in a million doses where somebody will get an anaphylactic reaction and therefore is recommended not to have that vaccine again. And so then the chance of having a 1 in a million reaction to both vaccines or both types of vaccines is really exceptionally rare. We have also heard from immunologists who are the allergy subspecialists that often people who have had an anaphylactic reaction to a COVID vaccine can still be vaccinated with the same dose. So what we actually recommend is if you've had a severe allergic reaction to a COVID vaccine, you can go and see an allergy specialist, and they sometimes do things like graded dosing and have methods to still get that tiny proportion of people can still potentially get the same vaccine. However, as Marianne pointed out, it is exceptionally unlikely that you would have an anaphylactic reaction to both types of vaccines or to ingredients that are in both vaccines, because the mRNA vaccines, Pfizer and Moderna, have different ingredients to the AstraZeneca vaccine that tend to be thought to be responsible for allergic reactions. So I would absolutely support your summary.
Yes, Dr. Sharma, there's a question here by Marianne Murad, who was saying, was just what you were saying, is the booster vaccine different to the normal vaccine?
So at the moment, the booster vaccines are not any different. So if you choose to have Pfizer, which is the recommended vaccine, it would be the exact same dose and formulation that is currently being used for people's primary course, which is the first 2 doses. Likewise with the AstraZeneca vaccine. However, this may change. So, for example, we know that Moderna, the company, has developed a variant-specific vaccine, which is a good choice to potentially use as a booster in future, because it would increase your protection against COVID, including a different strain. The other potential option with Moderna, it would be to use, for example, a half dose, because the dose contained within the Moderna vaccine is actually over 3 times what is contained in the Pfizer vaccine. So research will show whether those options or potentially other new vaccine formulations are better used as a booster. But currently, the ones that we have available are exactly the same vaccines used for the primary course.
Thank you, Doctor. There's a question here. What if I am immunocompromised? Do I need to get it earlier than others? What's the advice?
Sure. So people with severe immunocompromise are recommended to have what's called a 3rd dose. And there is a difference between a 3rd primary dose and a booster dose. And that's because people with severe immunocompromise don't make as good of an immune response to the initial 2 doses. And when I say immune response, that's measured by antibody level and also other branches of the immune system. There is some research showing that if you give a 3rd primary dose to those people, and that means a dose sort of sooner after their 2nd dose, they actually, about a 1/3 or so of that group will then mount a detectable immune response. And so the reason this is sometimes recommended earlier than a booster dose is because people with severe immunocompromise may have their first 2 doses and still be unprotected until that 6-month point. a portion of those will have the third dose, and then they will be protected. So the recommended window for a third dose for people with severe immunocompromise is 2 to 6 months. So you can still choose to wait longer. It's not a strict recommendation, but it can be given as early as 2 months. Whereas a booster dose is intended to boost your protection at the time when your pre-existing protection is falling or waning. And that's why you really do have to wait for that 6-month interval in order for it to be useful.
I have a question here, Dr. Gale. What do I need to do? Where can I get the booster? And Dr. Sharma, but what should I do to get the right information for me to get whatever I need, a third dose or a booster?
Yeah, thanks, Jess. Look, I'd suggest if anyone is in the community and thinks that you have an medical condition that might compromise your immune system, I'd encourage you to talk to your GP in the first instance if you're not sure about whether you're eligible for a booster or for a third dose, as Dr. Sharma said. So your GP is a good first port of call if you're not sure about what might be the best timing of a third dose or a booster for you. Boosters at the moment are available from GPs, and they're also available from New South Wales Health clinics, where you can book in now for boosters for those people for whom 6 months has now passed since when they finished their initial first 2 doses. So if you're unsure about what rules apply to you or what you're eligible for, I'd recommend talking to your GP in the first instance, and they can advise you.
Thank you so much, Dr. Gale. Now, here's another question. I'm learning so much about booster and the third dose, but do I need, and does anyone need, a fourth booster or fourth dose?
At this stage, it's not recommended just because there's not much data on fourth doses. And once that data becomes available, there will be recommendations made by ATAGI on the timing of the fourth dose in people who have had 3 doses for their primary course. And some of that data that's anticipated is what is the safety of the fourth dose, and are there any adverse events? What is the optimal timing, which again depends on when does the protection fall off after the third dose. And again, what is the optimal vaccine to use? So once information on those factors becomes available, ATAGI will be able to make a recommendation on the timing. But at the moment, somebody who's had their 3-dose primary course, if they had a 2-month interval, they're currently not recommended to go and get a 4th dose. And that also applies, we do hear of people getting blood tests after vaccination to see if they've had a response or not. But in fact, there is currently no lab test that can tell you whether your immune system has responded or not. There's no sort of confirmed level that means you've responded. So we don't recommend checking blood tests after you have a vaccine and having, 3rd or 4th or 5th doses. If the blood test, comes back suggesting something that you haven't had a response, we suggest you follow the guidance that for the vast majority of people, including people with mild immunocompromise, they only require 2 doses at the moment and a booster at 6 months or later. And people with severe immunocompromise require 3 doses. So the first 2 doses, and then 2 to 6 months later, a 3rd dose, and no further doses beyond that at this stage.
Thank you so much, Dr. Sharma. Dr. Gale, a question here. Why was there a pushback when unvaccinated people can do the same things vaccinated people can?
Well, thanks, Jess. Yes, look, that's news as of this week announced that there will be a change in that regard. And so it's another 2 weeks. So from mid-December, unvaccinated people will then have the same freedoms as vaccinated people. And that was a decision of government. I think the main and really important message at this time is for people to get vaccinated. We know that there's plenty of vaccine available. They are safe vaccines. They're highly effective, as Dr. Sharma has outlined for us today. And there are many different places where people can access them across the state, at New South Wales Health clinics, at many pharmacies, and at GPs. So there should be really no reason now why We don't have really high rates of coverage in New South Wales. We already have really high rates of coverage, which we're really pleased about. And we know that we can really increase that further. We've got such a high percentage of people who've had a first dose of vaccine, and I'm really confident that we can have at least that number receiving the second dose to get to that double dose figure. And we want that to be as high as possible, more than 95% if we can get there. And I'm really confident in New South Wales that we can. And the more people in our community who are vaccinated, it will be better for us all, for the individual to reduce your own risk of becoming seriously unwell, of ending up in hospital, and will also reduce the risk for us more broadly as a community, and will allow us all to enjoy more of the things that we all love to do in life, and to go out and about and enjoy the wonderful environment that we're in New South Wales, and to be less concerned about contracting COVID and becoming sick from it. So this extra time gives just more time again for people who haven't yet been vaccinated to come forward and receive their first dose and receive their second dose. And I'd really encourage everybody to do that.
Thank you so much, Dr. Gale. And Dr. Sharma, it's 4:30 and we've run out of time today, but we learned so much from you. Dr. Sharma, any last words you'd like to say to our Multicultural Media Online?
No, just would like to just echo Marianne's message that we're so fortunate to have these highly effective vaccines, and we can see the impact already that it's having in terms of what New South Wales has seen in terms of death from COVID compared to the rest of the world, and the impact on our health system. So it's a really fantastic situation to be in, and things can only get better from here as we push our vaccination coverage up and ensure we get booster doses into the population, and the opportunity to start vaccinating younger children just means that we're seeing even better days ahead.
Thank you so much, Dr. Sharma. Dr. Gale, any last words?
Oh, thanks, Jess. Just to say that, again, vaccination is an absolutely key part of us all living as normal a life as we possibly can with COVID. But in addition to that, it's really important that people continue to do the basic things well, and that is to wear a mask, especially when you're inside, to practice physical distancing, and very importantly, if you're unwell, don't go out and about. We are still seeing cases of people who have gone out and about when they're sick and not getting a test, and we know that there's plenty of places to get tested. That's a message that we all need to heed as a community, and even for fully vaccinated people. So even if you are fully vaccinated, your risk is much reduced, but it's still very important that if you have symptoms, that you get tested and you wait for your result, and don't go out and about. So vaccination combined with all those basic measures are really the key things that we all need to continue to do. So that's it from me. Thanks, Jess.
Thank you so much. And that's our Deputy Chief Health Officer, Dr. Marianne Gale, and our special guest for today, NCIRS Staff Specialist, Dr. Ketaki Sharma. And thank you very much for joining us again today on our Multicultural Media Online. We'll see you again next week. And both those celebrating Diwali tomorrow, we hope you celebrate the festival COVID safely. And thank you so much for joining us again. Stay safe, take care, and we'll see you again next week.